My name is Harold Winsett. I'm 59 years old. I'm a double lung transplant. I am privileged as a person to have been able to go through all this. I had a disease known as IPF, or idiopathic pulmonary fibrosis. In August of last year, I started to decline, and I declined very rapidly.
Pulmonary fibrosis can take a turn for the worse really quickly. The lungs are like a sponge, and so you can squish them, you can deflate them completely, but when they get fibrosed, it becomes really firm, and they lose your function. So within a couple of years of diagnosis, up to even 50% of patients may not be alive. Mr. Winsett's case is a very special case. Already we had decided, okay, he was going to get a lung transplant, but he came in extremely sick. He suddenly deteriorated to the point where he would not survive if he didn't get a lung transplant really quickly, even within the next 24 hours. So we had to use a special technique called ECMO, and the whole idea was to temporize him and to bridge him to transplantation in the hope that within the next few days we would be able to get a set of lungs from somewhere. 5 days passed and we did not have a sufficient or good enough offer to transplant him. And as time went by, his lung function, his body started getting affected by this, and he was at the point where we were getting close to saying, maybe we can't do this anymore, we have to withdraw support if we don't get an offer within the next 12 hours.
I honestly believed that I wasn't going to walk out of this hospital.
And then we got the offer. We got the offer for him, but he had a problem. And that was because of his pulmonary fibrosis, his right lung or right chest cavity was about half the size that it should have been. We've been able to use Lobar transplantation, where instead of implanting or transplanting an entire lung, we've been able to remove a portion of the lung known as the lobes. We were able to split the right lung and remove the top half and implanted only the bottom half on the right, while we gave him a full left-sided lung transplant. This has been done very rarely across the world. If we look at the published reports, since the 1990s, there have been about 300-something cases done in adults, and maybe less than 30 or 40 cases in the US itself since then.
It's incredible what they did for me that they hadn't done before, or at least hadn't done very much of in the past. But it got to the point that that's all they could do with me to make it work, so they had to try it. That was a 13-hour operation. They had a couple glitches while they were doing it, according to Dr. Thomas, but he got us all through it. I am absolutely honored to have met the folks that I've met here. I mean it with all of my heart.